This is Pat Iyer with Legal Nurse Podcast, and I've been talking with Fran Hoh, who's a registered nurse and advanced clinical specialist in the area of palliative care. Fran's world is pain control, preventing under medication and also preventing over medication with opioids and other types of pain relievers. Fran, give our listener or our viewer a taste of what we just covered in your podcast.
Oh my God, there's so much to cover. We talked about what patients are at risk for overdose of opioids. We talked about patients with a history of substance use disorder and how to manage them. We talked about PCA and some of the problems that can arise with PCA in hospitalized patients. We talked about some of the legislation that's now been enacted that makes it difficult for patients to access their drugs. Some of the systems that are in place to help protect patients, like the prescription drug monitoring programs now that are in most states. And we also talked about, finally, how some patients are undertreated for pain and how we can better do a better job with that as well by not cookie cutting, everybody into the same routine.
We covered a lot, Fran, and we decided that we could have talked for at least another hour at the end of the podcast. This is an area that affects the comfort of patients. It impacts on liability when there are overdoses, particularly in acute care. And we also touched on the fact that there can be overdoses in the home when somebody walks into a house and gets their hands on an opioid that was intended for the sick person in the house and is being consumed or used by the visitor or family member who is there to steal drugs from the patient.
Mm-hmm.
Be sure to hear Fran Hoh in her podcast, and welcome back to Legal Nurse Podcast. Be sure to catch our show on all of the audio platforms as well as on our YouTube channel for Legal Nurse Business. Thanks so much.